Welcome to the Bloodborne Pathogens course. Bloodborne pathogens are disease-causing microorganisms that exist in human blood and certain body fluids. Workers in many health-related professions have the potential to be exposed to body fluids or other potentially infectious materials, called biohazards. Occupational exposure, however, is not limited to workers in these fields. People who regularly handle soiled laundry or other waste products may also be at risk for exposure. This course will provide you with a knowledge about bloodborne pathogens, their sources, means of transmission, and methods to safeguard yourself and others. Over 162,000 new cases of hepatitis are reported each year. The Centers for Disease Control, CDC, estimates that over 1 million people in the United States are living with the human immunodeficiency virus, HIV, commonly associated with acquired immunodeficiency syndrome, AIDS.
Although the risk of infection remains small for most workers, it is also very real, and the consequences of exposure can be life-threatening. It is estimated that over 550,000 healthcare workers experience an exposure incident annually. Being exposed to potentially infectious materials does not mean that you will contract a disease. Nonetheless, workers who experience an exposure incident may also suffer from the adverse side effects of drugs used for treatment, or suffer psychological stress because of the exposure incident.
It is important to know that there are ways to significantly reduce your risk of exposure to bloodborne pathogens. Universal precautions, an approach to handling blood and other potentially infectious material, OPIM, is one of the most important control strategies that you will learn about in this course. If you follow procedures aimed at minimizing your risk, including universal precautions, your chances of being infected are very small. The information provided in this course will help you to reduce your risk of infection by bloodborne pathogens. OSHA's bloodborne pathogen standard requires employers to fulfill several obligations to its employees. Determine which jobs involve occupational exposure and provide timely training to all employees in these jobs. Develop, review, and evaluate an exposure control plan that is available to employees. And implement control methods to eliminate or minimize employee exposure. Go to the next screen to learn the rest of the employer's responsibilities. Employers are also obligated to develop procedures for investigating bloodborne pathogen exposure incidents, including documenting all incidents and injuries. Periodically review and update control methods as new technologies become available, and actively solicit input from employees who have direct care responsibilities about possible improvements in control methods.